Hello and welcome to the Wellbeing Services. The Wellbeing Services is the primary care mental health team in the south side of Glasgow. Today I will be talking to you about post-traumatic stress disorder, or PTSD. What is PTSD? Post-traumatic stress disorder is an anxiety disorder caused by a very stressful, frightening, life-threatening or distressing event. PTSD can occur in people who have experienced or witnessed a traumatic event, such as a serious accident, severe injury, serious health problem, or a violent personal assault or attack. The way in which symptoms of PTSD are experienced varies widely from person to person. The symptoms of PTSD normally begin within the first few months after the traumatic experience has happened. However, some symptoms may appear later. What are the symptoms of PTSD? Symptoms of PTSD can cause significant distress and upset, as well as causing problems with a person's functioning, well-being and mood. These symptoms are often severe enough to have a significant impact on the person's day-to-day life. Trauma symptoms can be categorised into 4 areas of difficulty. Number 1, re-experiencing and memories. Number 2, hyperarousal, changes in the body. Number 3, avoidant behaviour. Number 4, changes in mood and thinking. People who have symptoms of PTSD can experience intense, disturbing thoughts and feelings relating to their experience that last long after the traumatic event has ended. They may relive and experience these frightening events again through flashbacks and nightmares. They may feel sadness, fear or anger, and they may feel detached from people around them. They may lose interest in things they once enjoyed and have trouble feeling affectionate. People with PTSD may notice that they have started to avoid situations or people that remind them of the traumatic event, and they may have strong negative reactions to something as ordinary as a loud noise or an accidental touch. They may also have problems with sleeping and also find it difficult to concentrate. PTSD can occur alongside other difficulties, such as depression, substance use, memory problems, and other physical and mental health problems. Our traumatic response. We all have an internal alarm system called the fight and flight response. The aim of this internal alarm system is to keep us alive. It is automatic and immediate. When we sense danger, threat or risk, our flight and fight mechanism is triggered. This then rapidly and automatically releases adrenaline and energy into our body to help us fight the danger or flight, run away from the danger as fast as we can. We cannot survive without our fight and flight system. In your own traumatic experience, your fight and flight mechanism will have been triggered and will have guided how you responded and behaved in that experience. Our fight and flight mechanism is very sensitive and can be triggered by false alarms, such as a thought or a memory, when there is no real threat present. Your life is not in danger thinking about your traumatic experience. However, because you feel anxious, worry, dread and fear, your body reacts in the same way it would do if you were in a life-threatening situation once again, which is very unhelpful. An aim of therapy is to learn to control this alarm system when it goes off unnecessarily and when it is unhelpful. Getting started on controlling symptoms of PTSD. Number 1, controlled breathing. Controlled breathing is a relaxation technique which reduces the body's symptoms of anxiety, panic and stress. When you are anxious, panicked, or stressed, your fight and flight mechanism tells you to breathe in more oxygen. We therefore lose the balance between oxygen, what we breathe in, and carbon dioxide, what we breathe out. This imbalance is called hyperventilation, which can cause uncomfortable symptoms such as heart palpitations, sweating, and feeling dizzy, lightheaded, and weak. Learning to control our breathing means we learn to control and reduce the symptoms of fight and flight. Controlled breathing is slower and deeper than normal breathing and happens in our stomach rather than our chest. Imagine a balloon in your stomach. Breathe in slowly, counting to 4. As you do this, you should notice your stomach moving out slightly as if the balloon was inflating. You then breathe out, counting to 4. And doing this, you should notice your stomach move in slightly as if the balloon was deflating. Repeat this cycle. Number 2, safe place relaxation exercise. Visualization or imagery is another useful relaxation tool. Bring into your mind a place where you feel peaceful and safe. A place where you feel completely calm and relaxed. Imagine this is maybe a previous holiday you have been on, or it may simply be somewhere like your garden, your allotment, or your local park. The aim of this exercise is to allow you to escape from the trauma memory, as well as escape from any daily stresses, to allow your mind to imagine a place where you feel completely safe, calm, and relaxed. Use your senses to imagine yourself in your safe place. What can you smell, taste, see, touch, and hear in your peaceful place? This can be a useful relaxation exercise to practice to calm yourself down after a frightening nightmare, flashback, or memory. Number 3, grounding techniques. We can manage our flashbacks, nightmares, and memories by using strategies called grounding techniques. Grounding techniques move our focus of attention away from past traumas to bring our attention back into the present moment where we are safe. Mental grounding strategies. Mental strategies are what we tell ourselves to bring our attention back to the present moment. If your flashback is taking your focus back to the past trauma, then use your own words of kindness, reassurance, and comfort to bring your attention back to the here and now. For example, the worst is over. It happened in the past and it is not happening now. I am safe now. I survived the awfulness then, so I can survive and get through what I am remembering now. Ask yourself questions in order to bring yourself into the present moment. Where am I right now? What day of the week is it? What year is it? These questions will help to redirect your attention away from your previously experienced or witnessed trauma and back into the present moment. You could say these questions to yourself or even write them down. Keeping a grounding card in places where you are likely to experience a flashback, for example, next to your bed, on your fridge, or next to your television, can be very helpful. Take a photo of this coping card on your phone and have it as a mobile phone screensaver or as a saved picture for when you experience a flashback outside your home. Physical grounding strategies. Physical strategies are practical things you can do to help bring your attention back to the present moment. For example, open your eyes, Put a light on if the room is dark. Look around you. Notice the colours, the people, the shapes of things. Listen. Notice the sounds around you. Traffic, voices, washing machine, music, etc. Notice your body, how your clothes feel on your skin, the movement of your hair. Feel the chair or the floor supporting you. How does that feel in your feet, your legs, your body? Smell. Notice the smells around you. Taste. Notice any tastes you may have. Use your senses to help bring your attention and focus back to the present moment and out of your previously experienced trauma. Touch. Some people like to hold or touch a grounding object, such as a small stone, pendant, or piece of jewellery, as a method of bringing their attention back to the present moment. When you touch this grounding object, this will remind you that you are in the here and now, to bring you back to the present moment and out of your previously experienced trauma. Smell. Try to find a smell that has a positive association for you. A smell that reminds you of happy times or a smell that you enjoy. If your flashback contains a strong smell element, a smell that was present at the time of your trauma that keeps reappearing when you have a flashback, then using a positive smell may be a helpful and useful grounding technique for you. For example, a small bottle of essential oil, perfume-soaked tissue, spices from the kitchen, or small dried flowers. Collect together items that are meaningful or that you know will be helpful to soothe you. It can be useful to keep this soothing bag or box in a handy place so that when you feel overwhelmed or distressed, you can go to this bag or box and find something that will be helpful to help you cope and to feel better. Treatment of PTSD. PTSD can be successfully treated through psychological therapies. Within the Wellbeing services, the Light Bulb Group is the first intervention offered to people who have experienced a trauma and who continue to experience symptoms after this frightening event. The Light Bulb Group is a 5-week educational group based on cognitive behavioural therapy principles and techniques to help you overcome symptoms of trauma. You can watch this group as a video link on the Wellbeing Services website, or you can sign up to this group that is delivered virtually by a qualified Wellbeing Services clinician. For any further information on any other mental health difficulties, please visit the Wellbeing Services website.